Okay, well, we still have a few people joining, but we'll let everyone get in but go ahead and get started because I know that's an incredibly busy time for everyone. Uh, just want to welcome everyone to International Medical Corps' final global briefing of 2025. Today, we're going to take a look at our work over the last 12 months and take a look forward to 2026 and what the coming year might bring. I'm Rebecca Milner, International Medical Corps Chief Advancement Officer, and I'd like to thank you for joining us today. As I know, like I said, it's an incredibly busy time for everyone. So thanks for making time for us. I also want to thank you for your tremendous support over the past year. We're really grateful to your commitment to our work and for your generous donations. In fact, that's what makes everything possible. So thank you very much. As we always try to do, we're going to keep today's briefing as efficient as possible. Our session today is going to be 45 minutes long, which will allow us to get into a bit of detail, but also give you a chance to have any questions that you might have answered toward the end of our conversation. So as we talk, please type your questions into the Zoom Q&A, and we'll do our best to get to them. If they aren't covered during our time today, we will definitely follow up with you. You know, when you look back at 2025, it's kind of hard to know exactly where to start when we're talking about humanitarian responses. It's been an incredibly busy year. Long-running conflicts, such as those in Ukraine, Sudan, and Gaza, continue to persist around the world, causing tremendous suffering and destructions. Natural disasters happened frequently and at a rapid pace this year. We responded to many in 2025, including the wildfires in our hometown of Los Angeles, flooding in Texas, a powerful hurricane in Jamaica, earthquakes in Afghanistan and Ethiopia, and most recently, the typhoons in the Philippines and Southeast Asia. You know, we also experienced infectious disease outbreaks, including Ebola in the Democratic Republic of Congo, Marburg virus disease in Ethiopia, and cholera throughout many of the countries in Africa. These infectious disease outbreaks affected people and health systems already struggling with other challenges. And International Medical Corps responded to these disasters in an environment where the funding landscape and its effects on health systems around the world is rapidly changing. So it's been quite a year. I'm happy to have three of our expert colleagues with me today who are all well acquainted with these challenges and how we're preparing for 2026. First, I'll introduce Dr. Jill John-Kall, who during her long career here at International Medical Corps has worked in more than 18 countries across Africa, Asia, the Middle East, and Europe. As a senior health advisor, she provides hands-on in-country and remote country support for our teams. Welcome, Jill. We also have Erica Tavares, who leads our programming in the United States and oversees a global portfolio designed to build the capacity of national and community-based organizations. She and her teams work to increase access to health services and provide training for organizations and individuals to help them better prepare for and respond to disasters and crises. Glad to have you with us, Erica. And finally, we have Paula Olson, who directs International Medical Corps programs in 11 countries across West, Central, and Southern Africa, as well as Latin America. Many of the countries she oversees have tremendous challenges, yet she and all of our colleagues are making progress toward addressing those challenges. And so we're really looking forward to your insights, Paula. Thank you for joining us. So, you know, as I noted, we respond to kind of three categories of crises, whether it's conflicts, disasters, or disease outbreaks. And we're going to kind of use that as an organizing principle today. And but I'd like to start by asking you, Jill, about our responses in Ukraine and Gaza. Where do things currently stand, and how are we adapting our responses to meet future developments?
Thanks, Rebecca. I'm going to start with Gaza. So, currently in Gaza, the situation is still quite unstable. We need the ceasefire to really hold before starting a formal recovery process. So, we're still focusing more on emergency response and providing life-saving services. So, we established and scaled multiple health facilities in Gaza, adapting to population movement and conflict dynamics. So, we have currently three field hospitals and two comprehensive primary healthcare centers, and a total bed capacity of around 400 beds. We provided more than 500,000 outpatient consultations. We vaccinated more than 15,000 children. We conducted more than 20,000 surgeries on adults and children, mostly trauma related. We even treated more than 8,000 children and pregnant and lactating women for malnutrition. And in addition, we also delivered mental health protection and WASH services to tens of thousands of people. But recent reports indicate that there's a high vulnerability to an infectious disease outbreak like cholera because 89% of Gaza's water facilities are destroyed. So there's inadequate access to clean water and sanitation facilities. There's still a lot of people living in very crowded living situations. And there's also the high rate of malnutrition, which kind of increases the risk of getting an infection. So all of this paired with the risk of importing the disease from outside Gaza. So this is kind of on our radar, but our team is really tracking this and other threats, and they're preparing to meet them head on. In Ukraine, we're following a little bit of a different strategy. So in the southeast, our emergency response is really focusing on communities that are close to the front lines with little or no access to healthcare. So we're bringing clinical services to them through our own mobile clinics, and we're also supporting ambulances and kind of existing clinics and hospitals that are still able to provide some level of care. We also continue to, provide critical life-saving trauma training for paramedics, doctors, nurses, and other hospital staff to prepare them for mass casualties. And we also provide CBURN training, which stands for chemical, biological, radiological, and nuclear events. And that's more important than ever because now we're seeing the rise of drone warfare, and we don't know where that's going to take us.
Well,
Um,
and also attacks on civilian infrastructure, right? I mean,
oh,
and
yes,
civilians,
absolutely.
period, right?
Absolutely, yeah.
Yeah.
And so, now we're also working with the government to start the early recovery process in some areas. And we're doing that by supporting and strengthening their health system and the reforms that they want to make. So, for example, we're currently in discussion with the government and CDC about the high rates of healthcare acquired infections and the high rates of antimicrobial resistance, which were both currently higher than they were in pre-war studies. There's other immediate concerns to address, like HIV, TB infections, which is going to be more resistant to treatment because a lot of patients have had their treatments interrupted by the war. We're looking at how to support their healthcare reforms by improving their emergency departments and looking at things like the need for emergency physicians, which is not a cadre, that currently exists. We're integrating sexual and reproductive health into the primary healthcare system because as it stands, patients just kind of go to the hospital for their routine, like antenatal care, which doesn't make sense, especially since the hospitals are so overwhelmed. And because of the conflict and where they're living, they might skip all these visits to get all together. And some people even deliver at home, not by choice. Um, we're looking at supporting other allied health services like physical rehabilitation, occupational therapy, along with mental health services. And as you mentioned, the attacks on healthcare, that's one of the things that we're looking at doing some research to. We've done that in the past in other countries, and now we're looking at Ukraine to really see the depth of the impact on all these attacks that have really targeted healthcare workers and healthcare facilities.
And the impact on just the ability to deliver services, right?
Absolutely. Yeah.
Right.
And in the short term and in the long term as well.
Right, right. I mean, I think Ukraine kind of encapsulates our sort of global approach, right? Respond to the immediate, life-saving needs, but also really try to strengthen the existing health system and really be careful
Yeah,
not to set up any kind of parallel structure there.
absolutely. All the work that we're doing is always in line with the Ministry of Health and other government authorities.
Right. Well, and Paula, I mean, I guess the other big conflict that we mentioned is Sudan, right? I mean, and maybe you can talk a little bit about how we're doing in Sudan, but then also sort of the low level, low boil conflicts that are happening around Sudan, and the countries in that region.
Sure. Thanks, Rebecca. And thanks, as always, for creating a platform where we can talk about conflicts like Sudan, because as you can tell from media sources right now, there's not a lot of coverage happening about Sudan, and I've been grateful that we've been able to continually talk about that in these forums to keep, our community aware of this ongoing and very volatile conflict. And we're talking about a conflict that started in 2023. So we're in 2025, end of 2025. There's still no end in sight. At this point, more than 11.7 million people have been displaced in country, and that includes greater than 4.2 million who have now evacuated to other countries. Sudan is, if you look at the geographic location of Sudan, and I know I've brought this up a lot, it takes up a really large part of the continent of Africa. It's surrounded by key states around it. And the role that it plays in the region in terms of economic stability is huge. A lot of the central markets that we derive, economic support from in surrounding areas come from Sudan.
Mm,
So we're seeing massive inflation. We're seeing breakdowns of socioeconomic structures in those countries where these populations have fled, including populations who fled to Sudan to escape other conflicts in countries prior. So I'm talking about countries like Central African Republic that has a massive displaced population that actually went to Sudan and had to return back to CAR. And you can imagine when that type of thing happens, it's really really traumatic for populations that have to make that switch all of a sudden, right?
mhm.
So this is continued. This is a continued conflict. At the same time, anytime we see a displacement of populations, we're going to see a rise in potential natural disasters, but also disease. So in
Mhm.
the three things that we're trying to frame this conversation about, disease is a really big part of what happens when conflict arises and we have displaced populations. And so cholera has been at the forefront of what we have been fighting in Sudan. There's been an ongoing cholera epidemic, and International Medical Corps is providing primary and secondary health care. We also, to Dr. Jill's point, we're meeting populations where they are through our mobile medical units. And so it's still difficult to get people inside the country through a normal route. We're taking our personnel through Chad and having to go across the border to give that type of support on an ongoing basis. So when we look at Sudan, the spillover effect is real. Central African Republic is right on the front line. There's a lot of displacement of population there and the need for critical support on the border. But a country that's really important to watch is Chad. So Chad has been a central country to a lot of Sudanese conflicts over the past decades. In fact, it has a large population of Sudanese refugees from decades ago that have settled in Chad and have not moved. And now we're seeing that kind of repeat itself again. International Medical Corps is the lead in one of the major camps. It's called Dugui Camp. It's on the eastern border. It's the newest camp that was set up to host a population of 50,000 families there. And we have a primary health center. We're also doing nutrition and psychosocial support. And we were in the midst of a cholera outbreak, actually, that was declared mid-July of this year. It just ended yesterday. So I have some
Oh,
good news to bring.
there
There
you
was an
go.
official
Good.
declaration of the government that the cholera outbreak has ended. Actually, if you Google this online, you will see the first observation on Google says International Medical Corps first to respond in Chad, which was, an amazing feat. We were the first to respond to this cholera outbreak when it was declared in July. So think about that. July until now, mid-December, we've been fighting this ongoing cholera outbreak. And it's still going on across the border. So as populations continue to move, that might come back. So again, I think it begs repeating. Anytime you see a displacement of population where there's already a strain on health resources, health personnel, when we see a scarcity of staff, when we see a scarcity of medical equipment and supplies, this ultimately leads to the spread of disease. And it can ultimately lead to greater conflict with the host community because you're already straining resources to a community that was strained before.
That's been forced to welcome 50,000 new families, right?
Absolutely.
In a low resource setting where that just puts additional pressure on those local communities.
Absolutely. And so we're continuing to monitor these, as you mentioned, a lower boil, not really getting a lot of attention, conflicts that are happening in the region. The countries that I'll note are really aligned to what's happening in the political arena. So anytime we see presidential elections starting up or we see a transition of power, there's usually a little bit of conflict that will arise as a result of that. So earlier this year, Paul Biya elected again the only president in Cameroon for several decades since independence was reelected. This year, that led to widespread political violence and displacement of populations. We're gearing up towards the presidential elections in CAR that will take place in just a few days, in about 12 days. Which might lead to more displacement of populations. Mali is a country that is really important to watch. Burkina Faso, all of these countries that kind of represent central parts of the region, the Sahel and Central Africa, are really, really critical that we pay attention to those because going into 2026, again, with the strain of resources, there could be more conflicts that arise. Quickly, how we are preparing, I think we do it the way that we always do. We can't anticipate what will happen with political conflict. We can't always anticipate how the conflicts will drag out. But what we can do is we always are staying in touch with our community. We're understanding and anticipating where the hot spots are going to be, where these displacement of populations usually go, so we can anticipate what those resources are. And then we're working with relevant government agencies. We're advocating with our donor community to save lives where it matters most. And I think the core of International Medical Corps is our training and capacity building. So where we have that time between conflict or while we're working on active humanitarian crisis, we are constantly training the population. We're constantly training our staff to make sure that they can be ready for the next conflict when it occurs.
Right. I mean, I think clearly, one of the big challenges to responding to conflict is the increased number of attacks on civilian infrastructure and health infrastructure, quite frankly, as well as the sort of incredible kind of mix of displacement, conflict, disease outbreaks, and how it just sort of all sort of snowballs into like a broader humanitarian crisis. And I think, we've seen that across all of our conflict-related responses. But natural disasters also drive a lot of displacement and economic harm. Let's take a look at some of those natural disasters that and extreme weather events that we've dealt with over the past year. Erica, maybe we could start with the United States because we've had two significant responses this year, whether it was the wildfires in Los Angeles or the massive flooding in central Texas. Maybe you can kind of summarize our responses there, but also talk a little bit about how they're similar and how they were a little different.
Sure. And thank you so much. And I think some of what my colleagues have already said, when we're summarizing our responses, and Rebecca, I think you said it right, respond to life-saving needs, fill gaps and strengthen the existing health system. This is the exact same approach that we take here in the United States. And so in the aftermath of the LA wildfires, we were on the ground very quickly, providing medical care, mental health care, distributing relief supplies, and we were doing that in the shelters, right? So again, some of the things that we see internationally, displaced populations as a result of natural disasters. We were providing medical care services, working alongside in Los Angeles, alongside first responders from community clinics and that were also in the shelters, and we were going in and helping to relieve them so that they could take care of their own families. But we also saw disease outbreaks, some of the very things that Paula is also talking about. We were also brought in and asked to help set up isolation facilities and treatment in the shelters, particularly in Pasadena, for outbreaks of COVID, norovirus, flu, and scabies. And so we saw the exact same thing that happened, which is when you get displaced populations, when you bring people together, you're very naturally going to have an outbreak of a disease. And so we were able to take so much of what we've done internationally and really bring it here to help at home. I think also in Los Angeles and also in Texas, our mental health programming has become increasingly important given the impact of these disasters in communities, and in both cases, talking about similarities, people's homes and lives were very much destroyed. And I think the challenge in overcoming that and providing frontline mental health care is also incredibly important. And so for us, that was in Los Angeles, down on Santa Monica Pier, really being able to talk with people as they were re-entering communities, as they were assessing the damage to their homes, and helping them to not only prepare for what they might see and help cope with that in real time, but also direct to additional services. Texas, the flooding in Texas, probably the primary difference was the size and the scale of the event. When you look at the wildfires really happening across the county and the flooding and the impact of a flooding happening in a much smaller community. But, that doesn't really matter when it's happening to you, right? These are people who are losing family members or losing their homes. And so we need to be there and to adapt our response to kind of meet the need on the ground. And so again, worked with one of the health facilities that was really thrust into being a first responder and helping to build their own capacity and fill gaps where needed. And mental health became a big part of our response there. We deployed 13 mental health professionals and volunteers. And I think probably one of the key differences was how we delivered that care. And I think this speaks to knowing how to work within communities and adapt your approach. So whereas in LA, we were sort of very upfront and vocal that we were providing mental health care services for people who felt who needed them in shelters on the pier. In Texas, it was a little bit different. The community we worked with there, we were a new actor. We had to really establish community trust. And so the way that we provided mental health services was actually to deliver hot meals at the community gathering site. And so we were there, our teams would be there. We would be serving hot meals to community responders or to people who had been affected, helping them access services, and then really talking to them to see, to check in on their wellness, to check in on their mental health and see if they needed additional services. And so it was a little bit of a different approach. But really working within the community in the way that would best work for them to help meet that immediate need.
Mm-hmm.
And then in the aftermath of both of these responses, it's paramount for us to be able to continue to work, particularly with community health clinics who really aren't, and we find this worldwide and we find it in the United States, aren't necessarily part of the response or emergency response planning, but are very suddenly thrust into the role of being first responders in their community. So how can they build their own capacity, think about what worked and what didn't, and be ready for a future disaster or crisis of any kind? And so we're still very much working with great partners in Los Angeles like Altamed and Pacific Clinic and Venice Family Clinic, as well as some of the community clinics in Texas, to really think about how they can continue to support their communities through recovery and support their communities and their fellow community clinics in the event of a future disaster.
Right. Well, I mean, Jill, Erica mentioned taking the learnings from our global responses and putting it to work in the United States, where we've been working for the past 20 years. But, you've responded to disasters all over the world. I mean, what are the constants that you see, and what's been changing in recent years, and how does that impact our response efforts?
So I think a lot of things are similar to what Erica just mentioned. So we've responded to a lot of natural disasters overseas and at home. Some of the constants that are things that we deal with in the immediate aftermath of displacement. So there's fear, anxiety, grief, shock, and the immediate need for safety, for medical and mental health services, and really dignity as well. And even in the most developed areas, health systems can be damaged, destroyed, or quickly overwhelmed. Information is fragmented. Decisions have to be made with very incomplete data. And so those are some of the constants that we usually see. But what's changed in recent years that I've seen is really the pace, the scale, and the complexity of these crises. So that trifecta of conflict, climate, and contagion paired with like fragile governance, that really leads to more frequent natural disasters. Climate-related shocks are not, they're no longer isolated events. They're just part of a continuous cycle of recovery and re-response. But I think the good news is that we've kind of also adjusted our own model to prepare and respond to these events. So what we usually do is we do a lot of capacity building, we strengthen local systems, et cetera. And the role of local actors really cannot be overstated. And now we're working with local governments, local NGOs, civil society organizations, and volunteer groups to not only strengthen their capacity as first responders, because that's exactly who they are, but we are providing training. We're supporting the development of emergency response plans. We're supporting coordination. We are pre-positioning emergency supplies. And all of that kind of helps them mobilize their response as quickly as possible. So I think we've kind of not changed our response. We've just enhanced it to provide better response for all these natural disasters that we're seeing.
Right. It's just kind of integrated into the way that we do business because now,
Yeah.
like you said, the size and scale and frequency is just kind of relentless, right? And so if
Yeah.
you're not doing that, then you're not getting ready for what might come next. Well, I mean, we've kind of touched on a lot of the disease outbreaks, but those are some of the more common diseases that we see. But this year also brought another, which I think was the 19th Ebola outbreak in the Democratic Republic of Congo. And then we're also kind of struggling to help Ethiopia respond to the Marburg virus, which is also a hemorrhagic fever. I mean, Paula, maybe you and Erica can talk a little bit about the medical and training components that were involved in the recent response outbreak in the DRC. And then, we can kind of go from there.
Okay. Yeah, thank you. I think, again, another win when it comes to looking at our response, global response to outbreak and disease. The DRC latest outbreak was declared on September 4th, just ended. The declaration was just closed on December 1st. So it's a real testament, especially given the current climate that we're facing right now. And I just mean, less resources and a lot of less partners on the ground that can have the ability to respond the way that International Medical Corps can, to respond to this outbreak, contain it, and then have this declaration so quickly after it began. So when it comes to the medical response, I mean, I loved what Erica said earlier, and Dr. Jill also mentioned it. We have the same kind of tenets around what is important to us. Training and capacity building, just-in-time training really is what we're calling it, because you're doing it and you're fighting against the time ticking down for an outbreak. So you're running against the clock to get people trained. We have never operated in Kasai province. Okay, so Kasai province is a new province for International Medical Corps. It's very new for a lot of first responders, actually. And this particular area is so remote that getting in there was a huge challenge, logistical challenge, but also being able to set up and work with this community. The last time they saw an EVD outbreak was in 2008. So there were very few personnel that were still trained and able to be active. And so one of the first things that you need to do is you need to have a workforce that is capable to respond to this outbreak. And it's such a unique outbreak. It requires specialized personal protective equipment, PPE. It requires specialized infection prevention and control. So that's not easy to find or source on the local market. Those
Right.
things need to be
And health professionals are particularly vulnerable, right?
Absolutely. They're vulnerable physically and they're also vulnerable mentally. As Dr. Jill pointed out, a part of it is the stressors, the mental stressors of knowing how contagious some of these viruses are, right? And so the first thing that we focused on as International Medical Corps was the training component, going in there and making sure that we were working alongside the Ministry of Health and conducting on the ground training. This was the first time a rapid response training for case management, which is actively taking care of patients that are infected with this virus, took place in that area in Bulape, which is the epicenter of the outbreak. So that was huge. Then after that, we pivoted and we trained first responders in Kinshasa that would then deploy to the center, and that would be able to shift out with medical staff to continually provide that surge response and capacity that was then deployed to the 6 areas that were really the most impacted by this latest outbreak. Part of that was also ensuring that there were community volunteers that were also trained, and making sure that there was a surveillance component. So that just means that we're monitoring in a broader scale of anyone that has any symptoms of the disease and really getting them to early care very quickly. And that includes also making sure that health personnel that are attached to these health facilities where we're screening and referring patients know how to protect themselves, to your point, Rebecca, but also know what it means to keep well patients who are well, and patients who are sick isolated, so we don't further spread that disease.
Mm-hmm. Yeah. I mean, Erica, is there anything that you would like to add about sort of that training and capacity strengthening piece?
Yeah, sure. I mean, I guess just in the same way I had talked about it being in the US, right? These are staff at health facilities that are not necessarily part of a country's emergency management response, infectious disease outbreak response plan, who are suddenly thrust into a very dangerous situation, where there's high levels of mortality from these diseases, who then need to be first responders. And I think, one of the things that I think we're all honored to do is to really help the frontline health responders help their communities, right? And it's training them to keep them safe and to keep them on the job, and to be able to show up and to do that in a remote area in the DRC. And now we're also doing it and being called to do it. One of the very few partners the Ethiopian government has asked to provide that same kind of training in Ethiopia for this Marburg outbreak, which is very similar. And so it's really about giving, the knowledge and the skills to the frontline health workers, but also the confidence so that they can show up to work, because these are also diseases, when we're talking about training and capacity building, that come with an enormous amount of misinformation about why they're spreading. And we're also up against, very sort of entrenched cultural practices around burials and treatments of body that spread the disease. And so, you have to have health workers in a community, right, training at the health worker level, but we also train community-based and local organizations to really help train community members about why we need to change some of these, very closely held personal practices in order to save lives. And so that's an enormous uphill battle to climb when you're looking at stopping the spread of the disease. But when we're able to do it, right, it has outsized impact. And so I think that's also an incredibly important part of the training, that it's not just kind of going in and providing refresher training, in a very sort of kind of clinical way, but it's also really helping health workers and community members understand how the disease spreads, why it's important, what are the infection prevention control practices we need to adapt and adopt to stop the spread of this disease and help protect the community at large. And so I think, just the ability to be able to do that and of our teams to do that on the ground is incredible. And we're just such a trusted partner of the Ministry of Health in providing that kind of service, that that will really be able to make a difference.
Right, right. I mean, Jill, I mean, maybe you can talk a little bit about that, the sort of clinical training versus the community-based, uh, trust building and and information management that we have to do kind of simultaneously or at the same.
Sure. I mean, we're currently talking about diseases like cholera, Marburg, Ebola, and hepatitis, polio, etc., measles. So we've responded to all of those in the past. And there are really two levels, like Paula and Erica were saying. One is the healthcare workers that we have to train from the clinical perspective, but the other is the community, because that's where everything's actually happening, right? And so one of the things we saw pretty predominantly, even back in COVID, was a hesitation to kind of um, change minds, right? Because, like Erica said, these are very like long-held cultural beliefs and practices. And the way we kind of did that is first, we've done things like vaccine hesitancy surveys, right? Or other kind of surveys where we go into communities and we work with community leaders to try to help us. So it's not like, foreigners going in there and asking these questions,
Right, right,
because that's kind of suspect. So
right.
we kind of first go to the community leaders and kind of train them on different health topics. They are allowed to ask questions, raise their own issues, et cetera, et cetera. Once they're trained, they are the ones who actually go into the community and kind of educate their own people about, prevention of diseases, how to cook and food, how to handle it, how to store it safely. Same with water storage, how to bury bodies, et cetera, et cetera. Because all of these have cultural nuances to them. And I think that really, the way that we approach that really helps us. And it's a huge part of containing the actual outbreak, because a lot of people, there's so many diseases and it's hard to keep track of what is spread by, respiratory droplets or versus shaking someone's hand or doing laundry for someone or something like that. So we
Right.
address these as they come in. And a lot of times, and of course, now we have local partners that do the same. So even if we're not responding, those messages go out consistently. One of the things that I'm a little bit more worried about is the threat of new and emerging diseases like avian flu, Nipah virus, and of course, there's multi-drug resistant bacterial and fungal infections and those kind of things. And I think recently there was a confirmed case of avian flu infecting a human, and that's notable because the the usual strains that are involved, we had H1N1, the swine flu from before, then came bird flu, H5N1. But recently, this is the first case of H5N5 strain in a human. And that was actually confirmed in Washington state in the US.
Mm,
So we know that this is happening globally. And one of the ways that we work to combat this at the community, the health facility, and the government level is through the One Health approach. And the One Health approach basically links human health, animal health, and the environment. And we're doing that in several ways, like strengthening surveillance systems, making sure that those alerts come in on time so we can respond quickly. We're supporting climate health at the community and health facility level. We're engaging and informing communities. We're building the capacity of local actors to prevent, track, respond, and contain these threats really quickly. And that's something that I think we'll see that globally as a much broader approach as people continue seeing like these outbreaks here and there.
yeah. Well, you kind of just leaned into my final question for everyone is sort of like what do you think that, you would celebrate as a success in 2025? And then what are you kind of excited about the potential to, have a tremendous impact in 2026? You want to
Um,
go? Go ahead.
Oh, okay, so I guess for 2025, like we made it, yay. There's a lot of times I didn't think that we would make it, but we did. Um, what inspired me this year was actually our teams because they did an amazing job of providing services to those in need, despite the funding cuts, despite the layoffs, despite everything against them. They really went above and beyond. So that is my number one kind of inspiration for this year. And in 2026, I kind of look forward to a couple of things. I look forward to the return of trust in science and evidence-based knowledge. I think that is really necessary. It is a requirement for us as human beings to stay healthy. And that is the foundation of our work and our own health, So I'm really looking forward to that. And I will cross my fingers. I'm also looking forward to the expanding our role or the role of technology in the work that we do. I think that can be anything from our PIMS program to track pharmaceuticals to the last mile. Easier ways to diagnose diseases, all those kind of things. So I'm really looking forward to kind of seeing
Impact.
what technology can do for us. Yeah.
Yeah, that's exciting. That's good. I don't know, Erica, what do you think? What are some of the things that you celebrate about 2025, and what are you looking to do in 2026?
I think one of the things that was sort of most inspirational over the last year and continuing into next year, and I want to thank everybody on the call because it is because of the support of our donors that we're able to do this, was the partnership that we have with our community clinics. I was in a number of meetings this year, met with community clinic partners, particularly in the US because that was where I was traveling, but who just were so grateful to have a partner that would come in and ask, how can we help you, this particularly local clinic, how can we help you do your job better? And reflected back to us that have a partner that just asks what's needed and just shows up and consistently shows up. And we can only do that because of the great support we have, but was so gratifying, but also it just speaks volumes to the first responders who are on the ground. I mean, in so many cases in the US and abroad, the responders that are out there providing healthcare have gone through or are going through the very same set of circumstances that the people affected are. And they get up every day and they get there and they go to work. And if they're going to be there, the opportunity to be there for them, I think makes all of us, right, want to get up and do the work that we do every day. And so it's really because of that, I think so much of what we've done in 2025 is successful and it's what is exciting about, continuing to work into 2026.
Yeah. Paula, what do you think?
I love this question. And I love being able to talk about the positive because there is a lot of positive to talk about. 2025 for me was a testament to the resiliency of the humanitarian spirit in so many different ways. I echo what has been said by Erica and Dr. Jill wholeheartedly. I think there were so many examples of not only our community base rallying behind us when times got really tough, but the staff, not only in our missions, but also at our headquarters, the personal sacrifices and dedication that took place in real time to make sure that we could continue to do this work was so inspiring. People giving up their full-time jobs, people volunteering to just work pro bono in any way, shape, or form they could because they believed in this mission and they believed that we still have a place. And that's so critical because it shows that, when the chips are down, people still believe in this work and that it needs to continue. In 2026, we went through a massive change in 2025. I think a lot of paradigms around the way that we do our work were shifted and broken. And the great thing about when something is broken down means we have the opportunity to rebuild in a very different way, in a way that can make us stronger. And
Right,
so,
build back better, right?
exactly. And when the humanitarian community is challenged, we always rise to the occasion. So going into 2026, I know that we'll have a lot of challenges. There will be a lot of pressure, but our task is not to hang on and create those systems to come back. Our task is to innovate, be creative, and make sure that the system works for the future. And we have a huge opportunity to do that in 2026. And I'm really excited about that.
Well, thank you. Thanks for sharing that, Paula. What a great note to end on. And I just also want to thank everyone who joined the call today. I mean, you've heard about our important work that we do around the world, and I mean, I'm purposely using the word we because we are doing this work together, and your support is so important to so many people around the world, and we're deeply grateful for that during this season of giving and thanks. Just wishing everyone a peaceful, happy holiday season, a happy and healthy 2026, and we look forward to seeing you at our next briefing call. So thank you, everyone.